So sorry about that. My camera, I didn't check the storage on my phone. Didn't think about it. So I had to clear up some storage to be able to finish my video. So this is probably going to be part 2. Yes, I have crazy hair going on. I don't know where the baby hairs are totally coming from. I do actually. It's taken me 2 years to recover my hair from having Caroline. But with that, so Eddie's surgery was this one, the full cranial vault revision. So it means they cut just above his eyebrows, or eye sockets. His eyebrows float somewhere in here. All the way around the skull. All the way around at that level. They removed parts here and did what they call barrel stays, cuts here. So that way it would open out. So it will open out. These cuts and these cuts all had plates to kind of hold the skull where it needed to be, and they were protective dissolvable plates over that. All these plates kind of floated. They were on like a system to float of screws. They made new sutures, very straight, very man-made, very obvious. With that said, anybody who looks at an x-ray of his skull now, or at a CT of his skull now, will see where they fixed the skull and changed it. His skull does not now, on the actual skull, look anything like it's supposed to for other people. Which is fine, because it never looked like it was supposed to for other people. His CVR was necessary, not cosmetic. We did not do it because we thought he was going to look funny. We literally did it because his sagittal suture was causing his head to smash into his brain. Now, it's not as easy as your skull touching directly to your brain. This is where a lot of people got confused and thought he was having brain surgery. He did not have brain surgery. His brain was never touched. And where your brain can come in contact with your skull, back here at the base, there is an opening like this, that you have a brain stem that kind of sits in that opening or just above that opening. For some people, they do have brain surgery. Sometimes the brain stem has to be reevaluated. Other parts of the brain is hemorrhaging around the brain stem and all coming through that opening. So like it's all hemorrhaging through the opening. He did not have that. And that is not actually craniosynostosis, but a good portion of kids with craniosynostosis also have that malformation, which is called Chiari malformation. Eddie does not have that. They did check him for that, though, because it is so common with this. He did not have that, fortunately, because that one you can revise and it will go back and revise and it will go back and revise. So if anybody has ever heard of that Chiari malformation, know somebody with Chiari malformation, understand that it is not a one and done surgery. It is not. Often it can be that a surgery is not going to help at all. So they don't. Their lives daily are affected by that. I just want to put that plug in there because I have witnessed so many of these kids that are cranial warriors go through that too. And I personally know people who are going through that, and it's awful. It's an awful thing. I can't even imagine it. And I can't even imagine watching your child go through that. So, with Edward's craniosynostosis, we got lucky. He did not have a comorbidity of Chiari malformation. He also didn't have severe intracranial pressure. If he had any, it was non-detectable. Though they think he did have some near the end before his surgery, because we were watching it, but not very closely because he wasn't showing major signs of it. Looking back now, I could have pushed more for more. I should have pushed more, and I didn't know to push more for a more in-depth observation of his cranial pressure. But it wasn't ever like severely delaying him or anything. He did have delays. We're going to get into that. Totally different situation, totally different diagnosis, totally beside that. The kid got the wrong poker hand when it came to some genetics. But at the same time, the right one. They have made him so strong. He's been through a lot. Joe and I, have parents, have been through a lot with him. And I think it's made us stronger. It made us the unit we are, and made it a stronger family for when Caroline came in. His surgery happened on March 16th of 2016. Right? Yes. It's the day before St. Patrick's Day, 2016. He was around 11 days past his 6-month birthday. And it took 5.5 hours. In that time, yes, and leading up to that, that was his second surgery date scheduling. His first one, we got there, we're in pre-op, and they had to cancel it because the PICU was, there were too many kids for Edward's safety with the flu. Too many children admitted. They had beds in PICU. We could have pushed for the surgery, but they were like, give it a couple weeks. These kids will be out of there, and it would be under sanitation, and he'll be safer, because after the surgery like that, after such a massive, after any surgery, but after such a massive surgery with the skull being opened and everything, and the fact that they weren't putting port tubes, drainage tubes in, they were leaving openings. So like very susceptible to infection at that point. So they didn't want too much of a contagious issue around him anyways. So March being cold and flu season still, children get it all the time. March being when they are all back together after being off for like winter break and Christmas and Thanksgiving, and then they're all back together after being around family. Children are petri dishes. It just happens. So they didn't feel comfortable putting him on the PICU ward because there were so many kids in the PICU sick with a rather communicable issue. So we waited, and we only had to wait like 2 weeks max, I think it was, before he went in for his actual surgery. This was good because I think it actually gave me more time to have already had that nervousness and go, oh, okay. To be fully honest, and I've said this many, many times before, to be fully honest, I wasn't so much worried about these surgeons going in and doing this particular surgery with Edward, even with the knowledge of a main artery in the head that once nicked, they can't fix it. It's a kill. These doctors, these particular surgeons had been doing this surgery when you ratioed it out twice a month for over 30 years. And that was just the CBR. They had done so many skull and facial surgeries together as a team that when you're around them before that, when I was around them in the office, they literally moved like twins. Like, people like to say that they moved like husband and wife, but they moved like twins. They knew physically what the other one needed before the other one even really physically showed that they needed it. And they were as one. They had honed themselves to the point that just existing around each other, they moved as one. And they were like twins, like identical twins, like you know, almost like Siamese twins. Like there was some sort of invisible part of their body that was connected. And I felt pretty certain that they would know. They would just know what was going on with each other, even though they would be in essentially two different parts of that room. my kid was in perfect hands with them. The unpredictableness of him never have been under anesthesia or any medicine similar to anesthesia made me really worried. We have a lot of family members who are sensitive to anesthesia, but they were never under it as infants. Caroline, sorry guys. Caroline, get down. Caroline, down, off. She's on the coffee table, which doesn't sound that dangerous, except for she doesn't hold still. She'll fall off. One moment. Come here. She's just too busy. But I was worried. Anesthesia scares me on the fact that you can have a pretty sizable reaction to it if you're allergic or too sensitive to it. Doctors always prep you about anesthesia, even if you've had multiple surgeries. They always prep you about it. So I was more nervous about that. I mean, I was sizably nervous about his surgery in general, but I was more nervous about the anesthesia, and I had a lot of questions, and they said good questions for the staff about the anesthesia and the anesthesiologist, who was going to be remaining in the room with Edward and would be observing him specifically to see any of the beginning signs that he was having adverse reactions to the anesthesia and be able to work around that. So there was that. I was pretty certain on that, but that just scared me. It scared me. As it turns out, he had a really hard time coming out of the anesthesia, and they had to administer adrenaline to him to get it out so that they could see if he could come out of it. That was a whole nother ballpark in the PICU, which made it really, really rough. But it was, and it was the worst thing that happened with the anesthesia, so we got lucky there too. His surgery never did actually open up to the brain. It did remove the skull from the brain cavity. And what I explain is, they explained it to us so well. You have your brain. Then you have a layer of plasma around the brain. There's just a layer that actually is on the brain. And it's kind of like a mucus film that just sits over the brain. First layer of defense. This is to keep any bacteria that can get through the other layers, last ditch attempt from it getting into the brain. But you can't do much after that. Then there's a layer, like a sac around it, and it's got a little bit of fluid between the sac skin and that. Then there's another sac around that that's like another like lasagna layer, plasma, fluid, and sac. Now the outer sac has a thicker layer, almost like a derma. So you cannot physically see the brain through these sacs. Now, his neurosurgeon sat at that sac because it has to stay wet. She sat there and kept it wet. Kind of like keeping a fish alive out of water. You keep it wet. She was also there to make sure that nothing happened with his neuroscape. She was also the one who made the initial cut and removed the bone for the plastic surgeon to do his work on it. I do believe she also made those other cuts. I trusted her, and I would always trust her with a child. She understood what childhood surgeries and childhood trauma and childhood illness, I hate saying illness because it's not like you're ill, but childhood complications can be like, because she was born with spina bifida, and I think it's amazing that she's a neurosurgeon and that her parents just kept pushing her on. I just think that's amazing. It drove me, and it proved to me that no matter what comes at Edward, his neurosurgeon was born with an infant scape issue that was life altering, and she was a neurosurgeon. She heads that department. And so she was doing his surgery, and his plastic surgeon he's just amazing. One of the most gentle men that I've met, and also both of them didn't talk like doctors. They just told you straight out what it was without giving you all these little terms, because you're not going to know the terms. The only terms they gave us was sagittal synostosis, and the actual word of, let me see where it is. It is on the front here. And the actual word of craniosynostosis. So that's all that they did. They explained what all this was meaning in like the most lamest terms for us. They explained why his head was shaped like this, why they went in and would do his team only did the CVRs. They didn't do anything else. They also explained what his little scar would look like. And they explained the healing process. So no, Edward did not have brain surgery. He had skull surgery. Earlier when I said that some kids get a misdiagnosis, it's because their heads can look like positional plasia, but it's actually a suture fused. So it looks like they laid on one side of their head the wrong way for too long. And often those kids get a helmet, but then the head does not form. And you get a lot of issues with it. That's the lambdoid issue. Now, positional head deformities will give you a push out in an opposite direction, whereas lambdoid does not. But a lot of doctors don't stop to look for the positional push out. Because like, have you ever taken a Ziploc bag of like that friendship bread, and you set it down and it kind of does this lumpy thing rather than this, like, that's essentially what the positional does to your kid's head. And you can reshape that out without any surgery. Sometimes you have to have a helmet, sometimes you don't. Eddie did not go home with a helmet. He never at one point ever wore a helmet, because of how many cuts they actually ended up making, and his team just didn't work with a helmet. They just didn't helmet him. Cranio kids, typically. Edward's head was overcorrected. And what I mean by that is because of how they cut the skull, and that the skull wouldn't go into its natural fusion process because those sutures weren't there anymore. They were man-made. And because those were trauma cuts, anytime you have a surgery or even a shot, those are trauma points. And your body works to fuse it back together, to heal the skin, any of that. Same with your bone. You break a bone, and your body, if you don't get it set, your body starts to heal it and fuse it back together, and it can set wrong. So that's why it's so important to get it set immediately, because your body reacts immediately. So as soon as they cut his skull and such and was placing things, it was trying hard to go back together, which is where those plates were essential. It wasn't so much to hold the skull together, but to keep it apart enough to do what it needed to do, to get used to that. So his head got overcorrected. So my baby who's, thank you. I don't need that. My baby who already is a toddler, a little baby with a bigger head anyways, because babies and infants and toddlers have big heads. Carrie, get down. When he had it corrected, his head ended up being a lot bigger. But as you see, the bossing went away. They fixed that down to where it should be, because it was out a bit more. They fixed the back of his skull to things, and then he ended up with this rounded bit here, which he never had before his surgery. And of course, his suture line. I had a couple sutures still left in it at this point. These were dissolvable. They were coming out on their own. We'd find little knots. We would just find little knots all over the house. It was so different for people who was over. If they found one, they're like, what is that? One of his sutures finally dissolved enough to come out. It was gross to some, but we were picking them up and we were giggling because this was our reality. Again, I have to reach forward and get this little girl off this table. She doesn't know not to lean across it. I have debated on showing this picture, but I'm going to because it's not, you don't see much. He just looks like he's sleeping. The only thing is his head wrap. You don't see any of his. I do have pictures that show quite a bit of graphicness, but this is him in recovery. This is what we got introduced to after those 5.5 hours. Joe holding his finger, put his finger down there, and Eddie, still not fully awake, grabbed his hand. So that was the moment we knew he was going to come around, and it was all fine. We were all in the clear, or what we call the other side. That was before he was moved over to PICU. He was in pediatric intensive care unit for a day and a half. Almost 2 days. We did a transfer in the evening on the second day to standard care. Because he had such a hard time coming out of the anesthesia, they kept him in there a little longer just to make sure that his body functioned, because infants under anesthesia can really have some big bind up issues and such. So we were waiting for diapers and bottles to process and come to us the right way. I'm sorry about that bang. That was a metal toy kitchen pot lid on our coffee table. Eddie's stay in the hospital, that was a Wednesday morning, and we went home on Sunday evening or early afternoon. Eddie and I didn't leave the hospital. Once we went in to his pre-op, went in to sign into pre-op, and then they pulled us back to pre-op. The moment I walked in for his surgery, carrying him, I didn't leave the hospital. I did get down to the lobby after he was moved to standard care. I got down to the lobby probably on Friday or Saturday to walk outside. My mom wanted me to get outside the hospital just for a second, a little walk. And then I got a phone call back up to his room because he was fussing and crying, and he was not being breastfed at that point. I had some issues with producing milk. Lactating didn't work for me. So he was bottle fed by then, but they just thought he needed mom again. So I went back upstairs, and I was there the whole time until he was discharged. Immediate family, grandparents rallied around, aunts and uncles rallied around him. The nursing staff at U of M Mott Children's Hospital in Ann Arbor, Michigan, that is where he had his surgery, were amazing. And we were lucky enough to have had one experience that most the patients at Mott Children's intensive care, pediatric intensive care, didn't get. Was we were living just off of Eastern Michigan's campus at the time in an apartment complex across the street from the softball fields. And because of that, we noticed right away that one of his PICU nurses was wearing women's softball team, Eastern's team shirt, and it was dated for that year. And we had questioned her on it. I said, "Oh, did you play and you're just cheering?" And she goes, "No, my daughter's on the team right now. That I watch her when I'm not at work." And I was like, "Oh, we can watch from our balcony of our apartment. We watch teams. We watch the games." I did that my whole pregnancy with him. And she thought that was amazing. So out of just the off chance, when the next game was, once Eddie was safe enough to go outside and do things, like a week or something like that after, once spring really came and the softball games started going again, we went over there, him and his little buggy, and we found her. And we have pictures. I did not print any of them. We have pictures of him with his nurse. And it shocked me as to how often those nurses think of their patients, because she remembered him right away. But he looked up at her and she went, his eyes are blue. I didn't think he would have that bright of blue eyes. Because his eyes were swollen shut. The whole time she knew him, whether he was awake or not, he could not open his eyes. That's something this picture right after post-op doesn't show you, because he didn't get swelling. Any of the indentation of his eye sockets was gone. Like, it was level. Actually, they puffed out further because of the trauma to the underneath derma from surgery. His whole face swelled. His cheeks swelled to the point that they were level with the end of his nose. And it did. It looked like his whole face was trying to eat itself. He had extreme swelling. He was set up at an angle, so the swelling could have been worse. Could have been a lot worse. As that healed and the bruising started and the skin that was overstretched healed, and he kind of looked like he was a little infant Rocky. He just always gave us this look like, you should have seen the other guy. You should see the other guy. I won. And it was just, he looked like he'd been in a bar fight. It was bad, but we laughed at it because you could either cry or you could laugh, and we opted to giggle because take light for where it is. Put light where it isn't. And that is essentially Edward's craniosynostosis journey. We go annually. We haven't been in the past 2 years. The pandemic's made us a little wary to go. Plus, it's more difficult because we don't live in Michigan anymore. And the follow-up procedures, they would want it only to be with U of M. And they didn't have those procedures all in one time. And we can't make it to Michigan repetitively at those times. We just can't. We have other issues pertaining to Edward too that cause it an inability to make that trip that often. And sometimes, because he's also autistic, doctor's appointments don't go as planned. I mean, they don't go as planned for most kids, but sometimes when Eddie has a moment, they're not going to happen. Like, they just can't happen. We have to reschedule. Well, we can't do that. And they weren't accepting our doctors here for some reason. They wanted it all within U of M system. And I get that, but we can't do that. So we're in the process of getting a transfer of his records to a team here. Because now where he's at with his craniosynostosis journey is until he's 10 years old. So we only have like 4 more years of annual checkups on his skull, just his progress, to see if he has any further surgeries needed. Most of the time, further surgeries are that there are holes in the skulls that need to be filled. Those are called filler surgeries. Yes, they'll reopen that same suture line and fill in with surgical cement, typically, like a plaster, putty, whatever. There's multiple different kinds of fillers. But we just have to see. There's a couple spots right along his incision line that I think might need to be looked at. But they're not causing any issues. And we have until he's 10. So sometimes children, if they have big enough issues, they have it before 10, but there's often kids that are going in around 10 for just minor filler surgery, which still puts them in for a little while and does a little bit of the swelling again. And I can't imagine doing it with his autism now at the level and understanding that he has. So, what? I might have to get going, which I don't want to make these too long. And I don't want to make them boring. And I don't want to, but I wanted to cover that. So, if you have any questions, please post them in the comments below. Let me know. If you have questions at the time of this video, which it's, I am going to post it to Facebook, to my personal page as well, to allow others to see it more, because I'm putting this right onto YouTube, because I know that that's a good platform for awareness, and the awareness is the cranial. I also wanted to be out there so that other parents could find it, and feel confident and understand and hear it, because I read after his surgery, because I didn't have any of these things truly before his surgery, but I had a little bit before his surgery, of being able to read families' experiences with cranial. Not often is it a severely traumatic issue. I mean, it's traumatizing when you realize your kid just needs this as an infant, but it's not often like a life or death thing. If it gets ignored, it can be, because it can cause seizure issues, and it can cause brain deformations that weren't going to be there. And that's why we opted for his surgery, because to us it was like playing a really sick game of Russian roulette with his brain that we didn't need to enter. So and we were going to enter it with his, because it was already so deformed, especially by 6 months, because it was diagnosed at 2 months. He was watched from 3 months on, with a team watching him. This team that did his surgery watched him to make sure that we didn't have to rush into surgery before 6 months. 6 months was our sweet spot for him. They didn't really want to go past 6 months for his surgery, too far past 6 months, because of how deformed his skull was already. Because then we would be entering to intracranial pressure. There's a lot more I can talk about on this. There's a lot that I've learned about it. Purple, the reason I'm wearing the purple, and the reason you can't see it, but there is a purple butterfly on our Christmas tree right up there. Because butterflies are an emblem of craniofacial anomalies, and purple is the color. So wear purple for craniofacial anomalies. Craniosynostosis falls under that, and that is Craniofacial Awareness Month is September, which is when he was born. He was born in September. And so yeah, I'm absolutely amazed at how far he's come. He absolutely loves his scar. He thinks it's cool. He tells people that his scar made him fast and loud. It's his belief that it gave him that superpower. Fine, I'll let him have it, because it gave him a superpower bigger than he's aware of at this age. He's 6. So, all right, I will post this out for people to watch, and then I am going to do a live Facebook event on my personal page for family and friends who have questions, because the questions have been asked for the past 6 years. Some of them I don't believe were answered fully, or some family members didn't realize what the extent of this was. So yeah, all right, talk to you guys soon. Thank you for listening.